The High Court in Pretoria today is hearing the National Health Insurance Challenge case brought to court by the Board of Healthcare Funders and South African Private Practitioners Forum. The BHF, representing 40 medical schemes covering 4.5 million beneficiaries, launched its challenge in May last year, asking the High Court to review and set aside the President's decision to sign the Act into law and to declare it has no legal force. Government has challenged the BHF and the SAPPF's decision to approach the High Court, arguing that the case should be heard at the Constitutional Court instead. Well, let's speak to Dr Katlego Mothudi, who is the Managing Director at the Board of Healthcare Funders. Doctor, very good afternoon to you. Thanks very much today. So today is about whether this matter should be heard by the North Gauteng High Court or the Constitutional Court. Is that correct?
That's correct, unfortunately. And we would rather have had it different, that we start going straight to the issues that we have flagged as problematic in the Act. Unfortunately, this is going to delay that process and finalization of a much-needed healthcare reform that would uplift the healthcare system of our country.
What is at the heart, remind us, of your challenge?
The Act, in its correct form, is littered with what we think are unconstitutional challenges. And these range from infringement of the right to access healthcare services by the citizens. And you've mentioned that the Private Practitioners Forum is also part of this challenge. There are also challenges to their ability to practice their crafts. And this is because of the contracting arrangements that are contained in the Act. And our wish is really to have clarification on some of these matters by the courts so that we can have an Act that is fit for purpose.
In other words, you are not opposed to universal access as such, but you have problems with the issues you've just mentioned.
Yes, we support the introduction or implementation of universal health coverage. And we believe that as the various players in the sector, we should all participate. In fact, as a BHF, we've already started advising the schemes that are linked to us to adopt a lot of these principles, putting in preventative care measures, focusing on primary health care, deploying coordinated care systems, and reducing out-of-pocket payments. And those are the elements that make up universal health coverage. However, from how the Act is crafted, we do not believe that it will actually put us on a path to do that. And as a result of quite a number of issues, I've mentioned two of the elements which we think are unconstitutional. But we think overall there are many other elements that make it difficult to implement. And in the list, the issue of costing. We think that by excluding medical aids from participating as a funder in the new system, we actually deprive the country of a resource. Remember that schemes already give access to around 9 million South Africans to healthcare services. And the money that they are paying, the 4.2 or so million members, is actually after-tax money. And this supports government's efforts to provide healthcare services.
You also have issues with its financial viability. In what way is that a problem, or why is that a problem for you?
So from a number of angles, and I can just cite what the Act proposes. There is a calculated shortfall, and this goes as far back as around 2017 or so when the white paper was crafted. There was already at that time an estimated shortfall of about 100 billion rand. We estimate that it's going to be closer to 2.5 billion. Now, that extra money has to come from somewhere. The Act proposes that they are going to introduce more taxes. And what better example did we see than what a week or two ago when the government tried to increase VAT, and it caused discomfort. And I think it shows that as a country, we probably have reached the limit in terms of how much we can be taxed. Now, what we're saying is that there's about 500 or so billion rand that's supporting the healthcare system, split between the private sector and the state. The private sector component comes from voluntary after-tax contributions. So it's not translatable into money that can be redirected to support the NHI. So there will be a shortfall. And the 250 or so billion that the state provides is hardly enough to carry the 50-something million that are entirely depend on the state. So you have to find money somewhere, and we have no idea where it's going to come from.
But the minister is on record. He has said in the past that the approach is going to be incremental. No, he has said that, I mean, nowhere in the world has this been achieved all at once or at a stroke of a pen or something like that. It's going to take years and years, and that journey may even be painful for that matter.
Yeah, we have to look at the evidence. We look at how the healthcare budget has been reducing over time. So I don't know where the incremental ability is going to come from. If we are not able to manage with the money that we have. Granted, we think that there are inefficiencies in the system, both in the private sector as well as in the public sector. And that's why we're also advocating that the health market inquiry recommendation should actually be implemented to make sure that we are using the little money that we have wisely. But if you cut out the medical aid schemes and other healthcare funders that are in the system, you immediately lose a huge portion of the funding capability. And I don't think any amount of incremental initiatives are going to eventually cover the shortfalls. I think we hear of austerity measures that are being imposed. Unfortunately, they also affect the healthcare services. Often you find that in many hospitals, by the end of the second quarter, financial quarter, you find that they would actually cut down on the services that are much needed. At the moment, government is unable to fill the much needed posts for healthcare practitioners as a result of funding. So I don't know what is going to generate this additional income that would see to the incremental portion of the services that we need.
Well, of course, I mean, until the issue of whether this matter should be heard in the Constitutional Court or in the High Court is resolved, those issues won't be ventilated in court just yet.
Definitely. We hope that this would not delay the discussion. It's not our wish to actually have this delay because we want to find finalization of the matter. I think the introduction of universal health coverage, everybody's under pressure. As signatories to the United Nations wish to expand healthcare services, we want to reach that target by 2030 as well. And as it is, for as long as we haggle over peripheral issues and not deal with the substantive matters of what stands between us and introducing universal health coverage, we will struggle. And healthcare is not a future need. There are people who need healthcare services right now. And we cannot waste valuable time arguing whether something should be heard in the High Court or in the Constitutional Court.
But why are you insisting on the High Court?
It's not us, Vuyo.
Mm-hmm.
We have seen matters pertaining to the presidency being heard in the High Court. And we believe that the president, like any citizen, if there are any issues of law that need to be ascertained, we should be able to ascertain the courts. And the High Court is the entry court for most of the matters. And I don't think it should be an issue that is used as a stumbling block. We'd rather have a judgment that says we should petition a higher court instead of it being put as a stumbling block. And we believe it's just a matter of delaying this matter unnecessarily.
But you have approached the Constitutional Court on a contingency basis, haven't you?
Yes, we have. And this is to ensure that there are no delays. If the High Court does agree that it does not have jurisdiction, we would then activate the other process and make sure that it doesn't further delay.
Let's leave it there for now. Dr Katlego Mothudi, thank you very much for your time. He's the Managing Director at the Board of Healthcare Funders.